Perfect. Thank you again, everybody, for joining us today. Just before I turn it over to the Premier here, I just wanted to go over a few housekeeping items. So first, we'll start off with those who submitted their questions in advance. And then in order to get to as many questions as possible, we'll be taking one question per outlet to ensure everyone has a chance to ask a question first. If you didn't submit your question in advance, just make sure to use the raised hand function so that we can get to you. And then second as well, this meeting is being recorded and a copy will be shared with you as well as the transcript. And you can also see the live transcript of this meeting right now and do a live translation to your preferred language. So if you were to click more, then click show captions, then you can select the language there. And then lastly, I'll just speak between each question to let you know who can ask theirs now and then who will be next in the queue. So without further ado, I'll pass it over to the Premier here for some brief opening remarks.
Great. Thanks so much, Sam. And thanks to everybody for joining us here today. I'll just say a few quick things and then we'll get right to questions because I know we've got a lot of them. Obviously, we're talking after budget 2024 came down on February the 29th, and it really is a pivotal time in our province's history. We wanted to put forward a responsible plan that will not only meet today's challenges head on, but also with an eye to the future and ensuring that we are securing that for the children and grandchildren who may not be able to benefit as much as we are from current resource revenues. The budget is a roadmap focusing on quality healthcare and education, as well as other social services, continued economic growth, and of course, enhanced public safety. And our government remains committed to do everything we can to make life better for Albertans today and for generations to follow. So first of all, we're building on Alberta's advantages. Budget 2024 is centered on maintaining our stable economic foundation so that we can foster growth not only in existing industries, but also new industries, as well as pay down debt and save to meet future challenges. Saving to meet future challenges is a crucial long-term, is going to be crucial for the long-term financial stability of our province. So this year, we will once more build our Heritage Savings Trust Fund, building off the growth from last fiscal year. For decades, the fund was not managed as it could have been, and in my view, should have been, but that does not mean that we can't place a stronger focus on that now. Former Premier Peter Lougheed had a vision that the fund would ultimately be able to eliminate our province's reliance on resource revenues. And I think we can still achieve that vision, and we will, so that our social programs and services that Albertans rely on are not in jeopardy today or tomorrow or well into the future. Secondly, of course, we're continuing to invest in Alberta's greatest asset, which is, of course, our people. Budget 2024 will focus on preparing for and responding to potential drought, sustaining modern, accessible healthcare and public services for families, and continuing to have the country's most business-friendly environment. We're making sure the province is fiscally responsible to ensure its long-term growth and future is the best place to live and work in Canada, while prioritizing the needs for Albertans and their families by investing in health, education, and safety. And with that, I'd be happy to take your questions.
Perfect. Thank you, Premier. So again, just a reminder, if you haven't submitted a question in advance, to use the raise hand function. Our first question will go to Sunny Full, and then after that, we'll go to GF. So Sunny, go ahead.
Good afternoon, ma'am. How are you?
Hi, Sunny. Good to see you.
Good. Daniel, thank you for doing a fantastic job. I really want to recommend presenting a balanced budget. But as usual, when you do budget, the questions do come. So like you did talk about mental health, you did talk about the social security. So I have two questions, basically, like being a proactive and reactive. The hospital in South Edmonton has been put on a pause. And that will basically impact social, like a waiting time in the hospital zone. And same thing, if you recall, we did talk about the Condominium Corporation Act also, right? The reform thing. So we did met with the STAR compliance, and the questions which they have, they are not being proactive. They're going back, they had a meeting we talked about. Do you have any plan for the boards? No. So whatever you're going to implement is not binding. So why anyone will be spending the time and the money on it? So being proactive, everything related to the mental health.
So a couple things. First of all, let me just scope out the nature of the problem that we had with the Edmonton South Hospital. It began as a project that was going to be 1.8 billion, and then it went through various iterations. And by the time it emerged on the other end of that, it was being proposed to be 4.9 billion, which would have made it one of the most expensive hospital builds in the country. Plus, we also know that something that starts off at that level has a bunch of change orders, and so it could very easily have ballooned beyond that. And it was only going to deliver 400 new beds. So when we looked at the proposal, we realized that we needed to pause and figure out, what do we really need? And we are still committed to having a health campus in the south of Edmonton, but we have to make sure that we're building the right kinds of support facilities there. So the first step is, we know we need a standalone Stollery hospital for children. The Children's Hospital is currently spread over 4 different hospitals, mostly U of A. And if we build a standalone Stollery, that will free up 246 beds, which is almost the same amount that we were intending to build with the Edmonton South Hospital. But secondly, we also know that we have 1,547 people who are awaiting placement in other types of care facilities, whether it's long-term care, mental health, addiction. Maybe they're poor and they need some homelessness support or rental support, or maybe they just need home care and their home renovated. So if you think about that, that's 1,547. That's 4 Edmonton South hospitals. So we think it's really important for us to make sure that we're making best use of our current space and then figure out what is needed. And one of the things we're beginning to see is needed is vastly more long-term care support, vastly more mental health support, addiction support, and also rental housing support for those who need to be in some kind of subsidized housing. So we have to do that analysis. It just doesn't make sense to spend $5 billion on a brand new Edmonton South Hospital when we have to solve all these other problems first. So we want to make sure that we're doing it right. So it's just going to be a pause while we figure all of those things out. And I think that Edmonton is going to be very happy with the additional space that we're able to free up as we build out the Stollery and then build the right types of facilities at the Edmonton South location. So that would be the first part. When it comes to mental health, we feel as well, by splitting off mental health into its own department with Dan Williams at the helm of that. And as we start moving more of the resources away from Alberta Health Services, we think we'll get better value for the dollars there, so that we can also build our recovery communities, build more mental health facilities, and be able to support addiction treatment. So we, for instance, I'll give you an example. Our recovery communities that have 75 beds only cost $30 million to build. So you see why I'm very concerned about a hospital costing $5 billion and producing 400 beds, when producing 75 beds only costs $30 million. We could build a lot more mental health and addiction treatment if we make sure that we're building the right kind of facilities. And then when it comes to the condos, I mean, I think the whole purpose behind it is to create a better tribunal system, so that if there are disputes between condo boards and the people who own the condo units, that they can be resolved. I mean, I can tell you, I live in a strata, so I've seen it myself, where a condo board started fining people because they put Christmas decorations on their lawns. And had too many flower boxes. So I know firsthand how out of control condo boards can be and how unreasonable it is, and that there isn't an avenue for appeal. So the whole purpose behind us doing that condo review is to at least create a forum so that an owner can plead their case. They may not always win them, but they need to be able to have a fair hearing. So we are intending to do that as well. I hope that answers your questions.
Thank you, ma'am. Thank you.